The teen mental health crisis is at historic levels. Data shows visits to the ER nearly doubled in a decade. I spoke to a psychiatrist and Maryland mother who described this as challenges unheard of before. The data is hard to ignore, and so is the alarming rate of teen mental health cases sweeping emergency rooms.
We've been in the ER probably about maybe 14 times for evaluations, and then 8 of those times she ended up going to a psychiatric inpatient placement right after that.
Sharon Vanderveer's voice couldn't be clearer when describing what her 14-year-old daughter has experienced.
She engages in risky behaviors, like lying down in the middle of the road or holding a knife or putting a string around her neck and threatening to choke herself or burning the ends of her long hair.
The Journal of the American Medical Association reveals a sharp increase of emergency room visits for children and teens rose from 4.8 million to 7.5 million.
And so you start to think, well, it's trauma, you kind of expect this. And so it's sort of like I don't know if you've heard the metaphor, the frog in the kettle of boiling water. Kind of a gruesome metaphor, but the idea is things slowly get worse and worse.
In emergency rooms, psychiatrist Dr. Rishi Gautam says proper intervention has proven far too difficult.
On an average, we are seeing at any point at least 5 to 7 children and families waiting in an ER for a plan for either an inpatient hospital bed or an outpatient treatment setting.
And that's a day?
That's in a day.
Dr. Gautam says the issues point to the need of more resources to prevent overwhelming hospitals.
They just have so many people that they need to evaluate. They just can't do it.
Healthcare providers say they are wrestling to provide a lasting solution.
How many cases do you respond to involving mental health?
At this point, at least 1 in 5 children in an ER are presenting with a primary mental health concern.
A frustration felt by all involved.
ERs become that space where families are metaphorically stuck in a limbo with no clear answer as to what the next step would be.
A cyclical nightmare Vanderveer has been dealing with for years, costing her family nearly $20,000 out of pocket in medical bills.
The problem is you get out of the hospital and then the child is just at home or maybe goes to a day program, and it's not like the problems are solved.
The question, of course, is what can be done? The first thing is to pay attention to the signs your child is displaying, like increasing isolation, irritability, or disengagement from family and friends. Another sign is persistently low moods, changes in sleep and appetite, or grades, all while change has been slow to materialize.
Our heart breaks when children need to come through the ER over and over again, seeking the same things.
Healthcare workers say offering a Band-Aid won't fix this problem. Dr. Gautam pointing to the need in more psychiatric-focused care. Now, here are some actionable tips for parents. When you see signs, go to the ER to begin the process of getting a treatment plan. You can also call the National Suicide and Crisis Lifeline. That number is 988. Another resource is a behavioral health agency. Now, Vanderveer says it does help to be hopeful because there are some promising resources that work.